Hey everyone, this is Dr. Gurung and I'm a pediatrician. Today I will be talking about some topics which are really simple yet very important. First, I will be discussing a few things about wellness checkups, which are also known as well child visits. We consider these visits as a cornerstone of preventive pediatric healthcare. These visits are more than just an opportunity to receive vaccinations, as it provides a holistic evaluation of your child's growth, development, learning, and overall well-being. Why are these visits important? They are important because it helps in early detection of conditions like learning disability, developmental delays, hearing or vision problems. It ensures timely immunization and helps in management of chronic conditions like high blood pressure, ADHD, eczema, and asthma. It provides patients and parents with guidance on nutrition, sleep, emotional regulation, and other behavioral problems. The American Academy of Pediatrics and Bright Futures recommends a structured periodicity schedule for these visits. The first newborn visit is within 3 to 5 days from the hospital discharge, following which the infant will have at least 6 to 7 visits during the first year of life. The next visits are at 15 months, 18, and at 2 years age. After they've had their 2-year checkup, they are generally seen once a year for their annual checkups. And during these visits, we often incorporate validated developmental screening tools like Ages and Stages questionnaire, which helps to identify conditions like autism or other developmental delays early on. These visits help to ensure timely immunization. We do vision and hearing screening test and also lead and anemia screening at 12 and 24-month age. For the teenagers, we start doing depression screening at 12 years. Hence, these visits are very important as they support early intervention, build stronger patient and physician relationship, and help children thrive. If I'm talking about well child checkups, I have to talk about sports physical. If your child is playing any kind of sport, whether it be soccer, track, basketball, or even just gym class, the checkup will ensure that they are healthy and ready to go. During this visit, we talk about their heart health, like if they've had any symptoms of palpitation, dizziness, sweating, any family history of certain cardiac death, arrhythmias, and other heart conditions. We check their muscles and joints, especially if they've had any recent injuries, fractures, or sprains. In female, we talk about their menstrual health and ensure that they have adequate calorie and nutrition intake. We even touch on topics like mental health, appetite, and sleep, as these are all connected. And here's what happens. We ask you and your child to answer some questions about the health history, and then we do a quick physical exam. If there's any red flag like past history of concussion or any pertinent heart condition, we may do some more workup or send them to see a specialist. That is why it's very important that you schedule the sports physical evaluation at least 6 to 8 weeks before the tryout, so that you have that extra time in case further workup is needed. Some parents may think, why bother with the sports physical if my child is healthy? Because kids get hurt and there may be some hidden health issues that you may not know about unless we check for it. We might catch a heart problem before your child passes out on the field. We can help prevent repeat injuries like concussion, especially if they've had one last season. And honestly, it's a chance for your child to bring up issues that they may not tell you. If it's time for your child to have their annual physical done or have their sports physical evaluation performed, please call your pediatrician. And lastly, I will take a quick minute to talk about HPV vaccines. HPV, or human papillomavirus, is one of the most common causes of sexually transmitted infections in the United States. According to CDC, about 13 million Americans, including teens, get infected with the virus each year. The virus can cause cancer of vagina, cervix, and vulva in women, and penile cancer in male. It can cause cancer of oropharynx and anus in both the sexes. The CDC recommends that all children from ages 11 to 12 years receive the vaccine, but it can be given as early as 9 years. For those who start the series before age 15 years, they will need only 2 vaccines, whereas for those who started later, will need 3 dosages. Some parents worry that the vaccine may encourage early sexual activity, but the studies have shown that this is not true. And sometimes parents think that the vaccine is not necessary because their child is not yet sexually active, but the goal is to vaccinate before they are ever exposed to HPV. Our data shows that the rate of HPV-related cancers and genital wart have dropped about 80% in teens and about 81% in young adult women. That is why, as a pediatrician, I want every child in our community to be vaccinated against HPV.